More than 500 people in West Nile from Adjumani and Maracha districts have received free eye treatment and cataract surgeries. Cataract is one of the biggest causes of blindness in Uganda. Studies show that almost half of all blindness cases in older people are caused by cataracts that were never treated.
2022, to go the end of that year, this one has come closer again. And at the time when this one is closing, then the vision of this one has come down. So up to now, I cannot say with this one, but this one, I will say you sit here, but who are you? I cannot see you.
In some parts of Uganda, like Karamoja, nearly 5 out of every 100 people are blind, and cataract is the main reason. Doctors said the biggest problem stopping people from getting treated are simple. Many people don't know cataract can be treated, some cannot afford the surgery, and others don't think they need help until it is too late.
Due to some financial problems and also old age, they cannot cross Kampala roads here and there like the young ones, so they remained. But this time, when Direct Aid brought diopters through Yumbe Regional Hospital, they have all been helped from Adjumani Hospital here.
Among those treated in this camp were both young and old. In Adjumani, one of the patients was Asio, aged 16. She stopped school after her eyes went blind. After the surgery, she promised to go back to school.
Good. She says she's very happy. She can go back in school. The last time she just started people, the sickness she getting in people. But now she's seen. She can go back in school. Even the father is safe.
In Maracha district, doctors had planned to treat 150 people, but because so many patients turned up, they ended up treating 209.
So we thank the partners who supported my community for having operated over 200 patients in my community. So thank you very much. So though the patients were overwhelming, over 500 patients stand up for the camp, but the majority of them have been worked on.
In Adjumani, the number also raised from the planned target to 353 people treated.
Direct Aid and Doctor promised to support Adjumani by operating at least 350. For that reason, we have hit the target. We have gone beyond 350. This time we have operated 353, which is 100% of the target. Plus certain surgeries which were also performed alongside. There are 25 excisions which were done. That is for the pterygium, this conjunctival growths, which looks like a website, and it is also affecting the vision of the people. So they were also operated. So we had 173 males operated for cataract surgery and 180 female operated for cataract.
Doctors said that if a person had to pay for this surgery on their own in Kampala, it would cost at least 1 million Ugandan shillings. That is a lot of money for many families in West Nile, and it is one of the main reasons cataract patients in rural areas go untreated for years.
That depression will take 1,500.
1,000? 1 million.
And I failed to get that money.
With support from donors, we can get the means to implement this project amongst those who are very poor and needy. Kampala and elsewhere is very expensive, but this is free of charge for those who are needy, and we hope that you will see again and resume work.
Patients said they were very thankful because a surgery that is normally expensive was given to them for free.
Hospital charges are very high, medicines are high, and the Muslim faith people help us freely.
Alikuwa miko mbaya kwa macho mmoja hiyo kwa side mwenye mimi nakula naye hiyo. Sasa ni kusapona, niko madadi mimi naangalia kama alikuwa miko na kuku mimi naenda nyumbani mimi nakata kuku yangu.
Today I'm so amazing to see my father is seeing back. I really thank the company so much. I thank Almighty God and I thank people service. It's not really easy for my dad to be blind, but today he's not seeing. I thank him for so much for that.
Medical eye specialist Dr. Otim Ambrose explained that in children, the most common causes of cataracts is infections.
Those who are born with the cataracts, it is because of maternal infections during pregnancy. For example, some mothers had syphilis, toxoplasmosis, rubella, and it was not treated during pregnancy. So these infections led to the formation of cataracts in children.
In older people, he said diabetes is the leading causes of cataracts.
Those who have chronic diseases like diabetes, so the cataracts develop as a result of the complication of diabetics. It may be because of the age. Majority of those who are older than 60, 70 tend to develop cataracts.
The camp was organized by Direct Aid Society Uganda. While officiating at the opening of the treatment, the country director Nourelhuda Abdallah Mohammed said a survey had shown that West Nile is one of the areas with the highest need of eye treatment.
The Adjumani was being selected due to the cooperation with the Ministry of Health. And from here, I thank them. I thank the Ministry of Health and their representative in the district, Adjumani district. We have signed with them an agreement, and they give us their priorities from where to start. And today we are starting from Adjumani, targeting 500 patients.
He added, Direct Aid Society Uganda plans to hold such camps in a different district every quarter.
And this project will not stop here in Adjumani. The plan is for the offices to do it every quarter, at least one camp in any one of the hospitals, the different hospitals or district hospitals in Uganda, according to the directive and the cooperation with the Ministry of Health.
For some patients, it was hard to believe they could see again after more than 10 years of blindness.
Mama, DC? D. Alo. D.
One woman said her struggle got even worse after her husband died.
She was taken to Yumbe, and there the husband died there. As the husband died, she could not be operated upon.
After her surgery, it was her neighbor who convinced her that the young woman standing in front of her was really her own daughter, a daughter who was only 3 years old when she lost her sight.
She was just chasing her today because she has not been seeing her. She was just surprised that this is her daughter. She was chasing her, no, you're not my daughter. You're not the one who have been helping me. That she just kept quiet, so the lady who was nearby them saying that this is your lady. She was just for us, she was just laughing.
The Adjumani RDC, Mr. Toko Swaib, praised Direct Aid Society Uganda for their humanitarian work in the area.
This surgical camp is in an arrangement where the ministry alone cannot do it. And the Adjumani district alone cannot do it. So when you have support from partners like Direct Aid, it really gives us a very big push. And the particular this number 350, I don't think even our capacity as a district or even as a region could handle that. And besides, our people sometimes deliberate arrangement where you mobilize them to come. But I want to give thanks to Direct Aid for the support they have given Ministry of Health, for the support they have given our district.
Direct Aid Society Uganda is a non-governmental organization with branches in Wakiso, Luwero, Gulu, and Mukono, and its main office at Najalankumbi. The organization supports communities with free education, economic empowerment, and other services. Health experts say cataract is easy to treat, but many people in rural Uganda still lose their sight simply because they cannot reach or afford surgeries. Camps like this one are helping to close that gap.
If a child has cataract, and it's not worked on early, they can become blind, and sometimes it becomes irreversible to correct. So inshallah, in this comes because we don't have very many pediatric ophthalmologists in the country. We don't want them to miss out on this opportunity.
For Nour Media, I am just Raj Mobaje, reporting from West Nile.
Nour Media 256, lighting your life and hereafter.